Your time has expired. Senator Henderson.
Thank you very much, Mr President. My question is to the Minister for Senior Australians and Aged Care Services, Senator Colbeck. Can the Minister provide an update on the number of Australians accessing a home care package and how the Liberal and Nationals government is supporting senior Australians?
The Minister for Senior Australians, Senator Colbeck.
Thank you, Mr President, and thank you, Senator, for your question. And particularly, Mr President, thank you, Senator, for your interest in improving the lives of senior Australians and their families. Mr President, it's been clear over a period of time now that people want more choice. They want to stay connected to their communities. They want to stay as independent as possible. They want to remain in their own homes. Mr President, and our government is delivering on that. The government announced in the budget, as part of our response to the Royal Commission, a further $6.5 billion as an investment to release 80,000 additional home care packages. That's 40,000 packages this financial year, Mr President, and a further 40,000 packages next financial year, Mr President. That is the single largest investment in home care packages ever. The new data shows that in the 3 months to the end of September this year, the number of people with access to a home care package grew to over more than 204,000 people, which is an increase of over 41,000 in the last 12 months. Mr President, since the 2018-19 budget, this government has now invested a record $11.9 billion, Mr President, $11.9 billion in new funding to deliver an additional 163,000 new home care packages. By June 2023, there will be around 275,000 home care packages available to senior Australians every year. And every year under our government, home care packages are up, residential care places are up, and every year, Mr President, aged care funding has been up. Mr President, Labor went to the last election with $387 billion in new tax proposals. Not a single dollar for a home care place, aged care quality and care safety or workforce, and nothing for mainstream aged care services.
Minister, your time has expired. Senator Henderson, a supplementary question.
Thanks, Mr President. How is the rollout of home care packages, Minister, expected to further reduce wait lists and wait times?
Minister.
Thank you, Mr President. Thank you, Senator Henderson. Mr President, the number of people waiting to receive a home care package continues to decrease as we work to ensure more Australians can live at home for longer, as more Australians are choosing to do. Mr President, under this government, there has been a significant improvement in the number of people waiting for their approved home care package, with a 25% decrease in the 12 months to September this year. 25% decrease to September this year. Mr President, those assessed as a high priority need at any level of home care package are now receiving their packages in less than 30 days. Less than 30 days. 99% of senior Australians waiting for a package at their assessed level of need have also been offered support from the government, including an interim package or CHSP, and continue to have access to Australia's world-class health system.
Senator Henderson, a second supplementary.
Can the Minister outline the design phase of the new home care system?
Minister.
Thank you, Mr President. In the government's response to the recommendations of the Royal Commission, Mr President, we announced a commitment to establish a new supported home program. This will replace existing Commonwealth Home Support Program, CHSP, home care packages, short-term restorative care and residential respite programs. Mr President, we continue to consult on the critical design of this new program, including elements of improved assessment arrangements that are more consistent, more accurate and recognise that not all consumers need intensive assessments, a modern classification and funding system to ensure the support senior Australians receive aligns with their assessed care needs, an increased choice of providers across all types and levels of aged care, focus on aged care management in assessment and funding arrangements, better support for informal carers, and importantly, Mr President, more support for early interventions to help people remain independent and home for longer.